Welcome to Module 3 of the Medical Surgical Nursing course. This final module addresses the specific challenges nurses face when caring for patients with varying medical and surgical conditions. It covers fluid and electrolyte balance, temperature regulation, and the management of different patient categories including those who are unconscious, in pain, or undergoing surgery. Let us start with fluid, electrolyte, and temperature balance. Maintaining these physiological parameters is essential for cellular function and overall health. Fluid imbalance can manifest as dehydration or fluid overload. Signs include dry mucous membranes, low urine output, edema, and altered mental status. Nurses must monitor intake and output, administer for fluids, and observe for fluid retention or loss. Electrolyte imbalance involves deviations in sodium, potassium, calcium, and magnesium levels. Symptoms include muscle weakness, arrhythmias, seizures, or confusion. Nurses are responsible for reviewing lab results, administering electrolyte replacements, and educating patients on diet and medication. Temperature regulation is vital for enzymatic activity. Fever may signal infection, while hypothermia or hyperthermia can be life-threatening. Nurses must monitor temperature trends and implement cooling or warming interventions as necessary. Next, we explore care strategies for specific patient conditions. 1. Incontinent patients require special skin care to prevent breakdown and infections. Nurses provide scheduled toileting, perineal hygiene, and barrier creams. 2. Unconscious patients need total care. Interventions include airway maintenance, repositioning to prevent bed sores, eye and mouth care, nutrition via NG tube or 4, and sensory stimulation. 3. Patients with acute illness, such as infections or trauma, require close monitoring, pain control, hydration, and emotional support. Nurses must also educate families about disease processes and expected outcomes. 4. Managing patients with pain involves identifying pain levels using validated scales, administering analgesics as prescribed, and using non-pharmacological interventions like heat therapy or relaxation techniques. 5. Chronic illness patients need long-term management plans. Nurses assist with medication adherence, lifestyle modifications, and provide psychosocial support. 6. Care of the aged patient includes addressing mobility limitations, cognitive decline, polypharmacy risks, and promoting independence while ensuring safety. 7. Preoperative and postoperative care involves presurgical assessment, fasting protocols, consent verification, post-surgical monitoring for complications, wound care, pain control, and early mobilization. Nurses also perform emotional support, health education, and discharge planning to ensure smooth recovery and reintegration. In summary, medical surgical nursing demands a thorough understanding of physiological principles, patient-centered care, and clinical decision-making. Nurses play an essential role in improving outcomes through vigilance, empathy, and evidence-based interventions. Thank you for completing this course. Your commitment to learning and improving nursing practice is commendable.